Almost there. We'll be starting in a second. Almost there. Meeting is being set up to go live. We'll be starting in a... Good evening, everyone.
Good evening.
Thank God for better weather. Not as hot as it has been, so we thank God for that. Welcome. Welcome to Medical Mondays with Dr. O. I am Dr. Toyin Okpesomi. I'm a family practitioner who treats HIV, drug addiction, everything that walks through the door in Maryland. And I'm so excited to be here again tonight. For our men, especially, we've been talking about men all this month, at least the second week of the month till now, and we'll be rounding up today. It will be injustice not to do anything about dental health when it comes to our men. There is a lot yet that we still need to do, that we still need to talk about, but we will be getting to those, as the year goes on. But for this month, we'll be concluding the Men's Health Month with men's jaw, airway, and mental health presentation by Dr. Wole Ajagbe. So, Dr. Ajagbe is one of our family. He's a regular on Medical Mondays and a wealth of knowledge. I'm going to defer to him to complete his introduction. If he doesn't do a good job, trust me, I'll interrupt him and do a better job for him. But without much ado, I'm going to yield the floor to him. But I also want to reiterate the fact that on this platform, we don't establish doctor-patient interaction. We're here just to share current, congent, and on-point information to help us stay in good health. So, Dr. Jagwe, you have the floor.
Yay, Dr. O. Thank you so much for another opportunity. Good evening, everyone. I'm sure we are all ready for summer, and summer is really heating up in many places. The temperature today around here was so high, but despite that, life goes on. Thank you for the opportunity to come and share something about men's health, focusing on some areas of the men's health that's been overlooked for many years. So simply, we're going to be looking at the jaw formation or jaw development, the airway, as well as mental health. How do they relate? How are they connected? Hopefully, by the time I spend a few minutes with us, we will be able to see clearly how they are all connected. So let's start. So today we're going to shed light on the overlooked foundation of men's health, which relates to jaw development, airway function, and mental health. Statistics has shown that up to 70% of people globally show signs of jaw underdevelopment, which then present as malocclusion. And it's been found that over half of the world's population has some kind of effect or effects of jaw malocclusion, jaw malfunction or underdevelopment, which leads to crooked teeth that we call malocclusion. In Africa, malocclusion rates ranges from 30 to 60%, but most of the time undiagnosed. men have been found to be disproportionately suffering, from functional jaw deficiencies, which affects breathing, affects sleep, strength, and mental well-being. So why does the jaw matter, or why jaw matters? We know that a well-formed or a well-developed jaw is essential for, maintaining a healthy airway. For many presentations, we have looked at the correlation between the jaw development and airway. And today we are going to kind of rehash that and kind of just remind ourselves about what happens when the jaw is not well formed. So underdeveloped jaw usually will lead to restriction of airway. And we've talked about upper airway restriction syndrome. And that is usually a segue into forming many systemic conditions that become chronic. So what are the signs of jaw underdevelopment? The signs of jaw underdevelopment include crowded teeth, weak chin, narrow face, bad breath, and mouth breathing. Now, you can see this just by looking around you. When you see somebody whose face is pretty long and narrow, the chances are that the jaws are not well formed. And when that person talks or smiles, you can see how crowded the teeth will look. And that often affects the attachment of the tongue to the floor of the mouth, and also will lead to a mouth breathing. The posture of the mouth is such that because the upper airway is restricted, the mouth has to remain ajar in order for the individual to be able to at least breathe. If their noses and sinuses are, clogged and they are unable to breathe through their nostrils. The goal of everybody is to be able to breathe healthy through their nostrils and not through the mouth. So jaw and airway impacts. We've already, alluded to the fact that small jaws or underdeveloped jaws will reduce the airway size. This will lead definitely to mouth breathing because, just like I said a few seconds ago, without air stream going through the nostrils in a normal way, without blockage or restriction, there will always be need by default for mouth breathing. And mouth breathing causes the mouth to dry up. And when the mouth dries up, frequently there will be increase in plaque formation, and that will lead to gum disease, that will lead to cavity formation, and that will also, because of the way the posture of the mouth is, the individual is not able to sleep well at night. And somebody who is a mouth breather, we've established this in the past, that they often will end up with a lot of throat infections. It may be very fulminating, infection, or it may just be a chronic enlargement of the lymph glands, which we call tonsils, as well as adenoids, which are which align themselves around the opening of the pharynx, which we call the throat. So sleep disruption, we know, is connected to poor rest, and poor rest often lowers the testosterone level among men and also reduces vitality. Now, we've established this before. Anyone who has poor jaw development that have airway restriction will definitely have sleep disordered breathing. And when they have sleep disordered breathing, usually the diagnosis will come up as sleep apnea, obstructive sleep apnea. And when obstructive sleep apnea is diagnosed, it is easy to treat, usually by using the CPAP, but many times they are not diagnosed. And when they are not diagnosed, it affects every aspect of life for the men who are suffering from jaw underdevelopment without any diagnosis and without any intervention. So, how do sleep and masculine health connect? Well, we know that everybody needs very good rest at night. But any man that does not sleep well at night, either due to interruptions in their breathing, which is caused by obstructive sleep apnea, the quality of sleep as well as the quality of rest will be affected. So anyone who does not sleep well, any man who doesn't sleep well because of their jaw malfunction or malformation as well as airway restriction will have diminished production of testosterone, and testosterone level is what is needed by men to be able to have vitality, good levels of energy and mood. People with very low testosterone, we know, usually moving in the direction of depression, not because of the lower testosterone, but because they have low energy and their mood is always swinging, and most of the time they don't feel like they are men. Poor jaw development interferes with proper sleep. We already established that, and then therefore will affect masculine health. So what happens when this problem is ignored long term? We know that most of the time when anything that concerns men, culturally, we say toughen it. You can tough it out. You just man up. You can't afford to just be affected by any of these things, even when physiologically we know it's definitely diminishing the vitality of the man. People still will use strong will and cultural, pressure in order for them to just ignore what the real problem is. So there are many men that are living unaware of jaw airway connection until complications arise. So if somebody has poor, underdeveloped jaws and doesn't breathe well, doesn't sleep well, doesn't produce the male hormone the way it's supposed to be, well, we know that they will not be living to their full potential. It doesn't matter how well they want to appear as though nothing is happening, their overall performance will be affected. And many times there will be complications, which will be the results from long-standing ignorance about the problem. So when the jaw health is ignored, and it leads to severe consequences such as sleep apnea, tooth loss, which is mentioned the first time now. The reason for tooth loss being mentioned is that many times when somebody is a mouth breather, they form plaque a lot, so they have gum disease. Chronic gum disease will lead to, untreated, will lead to tooth loss, premature tooth loss. Also, people who are unable to sleep well at night will always be tired during the day. That's why we assess them by doing the excessive daytime sleepiness evaluation. Anyone who cannot survive during the day without several cups of coffee, several, cans of Red Bull or any other high content, caffeinated drink or caffeine, a source of caffeine, definitely is suffering from sleep disorder. And until it's diagnosed, we can only call it sleep disorder. Until it's diagnosed as sleep apnea, we cannot label it as sleep apnea. But most of the time, anyone who sleeps during the day, you know, for any moment of time that they are idle, they fall asleep suddenly, or they are constantly dozing while driving during the day, they should be evaluated. They should check with their doctor, the primary care physician, and request for a sleep study. It's best for them to know that everything is fine than for them to ignore when there's something that is really wrong. So the long-term risk will lead to a whole lot of, generalized condition, which includes, heart disease, even diabetes, and of course, when somebody is non-performing, their level of confidence become very diminished and lowered. So how do we break the cycle? The way to break the cycle will be to do an early assessment, just like I just said a few seconds ago. If somebody is observing that they cannot do anything during the day without going through cans of Red Bull or drinking several cups of coffee, then they need to have their sleep assessed. Um, I don't think there should be any stigma attached to just knowing that your sleep is not good and you need help. So we can break the cycle by doing the early assessment. And if there is a jaw problem, the underlying cause should be treated. If the underlying cause requires expansion of the jaw to create space for the teeth and the tongue, then that should be done. If that is not done, the foundational problem, if it's not addressed, the resulting complications will not improve. So to break the cycle, there should be early assessment, there should be early intervention as to what is the root cause. When the jaw is expanded, the individual can then be trained on how to breathe properly, because they've been breathing abnormally because of their jaw posture and jaw formation, as well as the tongue position in their mouth. So correcting harmful habits also is necessary, because I'm sure each one of us will have known, or ourselves, if we are men, have been, involved or engaging in some kind of harmful oral habits. Some people have observed, have used their teeth to try to, undo mechanical bolts, from a device, thinking that their teeth are stronger than, what do you call it, the spanners or the wrench that normally is made to undo such bolts. As a result, many people will come to the dental office with fractured teeth, and they will not tell the truth, but they'll just tell you, I don't know what happened. My teeth cracked and I need help. We know of a fact that while we were growing up, maybe some people are still doing it now. People use their teeth to open bottles of carbonated drinks like Fanta, Sprite, Coke. They said, just give it to me, just give it to me. They use their teeth to pop the cap off. Well, it's only when they come to the dental office that we know that the adverse effect is very obvious. Sometimes it could be very severe when they actually crack the tooth to the roots. It could be in attendance to the discomfort. The pain is excruciating in most cases. So oral habits needs to be corrected, particularly by men. One of the other things that men do is when they're under stress or under any kind of situation that requires focus or attention, the first thing that most men do is to clench their jaws. If you can observe, sometimes if it's a stressful condition, you can see the muscles of the temporalis area contracting and expanding, because they are constantly clenching and grinding their teeth, but they don't know that they are doing it because it's kind of like an adrenaline rush in that kind of situation. So those kind of habits, they need to be corrected in order for the health to be restored. So what are some of the everyday actions that will cause the cycle to be broken? Simple steps include coming back to nasal breathing. If they are constantly having, if the individual constantly has nasal blockage, sinus problem, they're constantly unable to breathe through their nose, they have to seek help. Part of the help to seek is to learn how to unclog their nostrils through several techniques that they will learn from their, primary care physician or from the ENT surgeon if they have been referred to ENT surgeons. Now, breathing through the nose must be everybody's goal. Everybody's goal. Don't say, well, I've always been breathing through my mouth. I don't need to breathe through the nose. Everybody for health needs to breathe through the nose. If we have some time, I could address why air going through the nose is better than through the mouth. Chewing farm food. We know that many people, because of the crookedness or the crowding of their teeth, are unable to chew properly. So they will defer to chewing things that are very soft. We all need to chew foods that are pretty resistant to some extent to actually cause our teeth to continuously be strong in their socket. Posture, some people's, because of their job, condition, their head posture is wrong. When you see somebody who is constantly stretching their head, stretching their neck, tilting the back of their head backwards, that shows that the person is unable to breathe properly. And that is part of the things that we observe in people that have jaw underdevelopment, particularly small lower jaws and crowded tongue. And the only way to do that is when they stretch their neck up and their chin moves forward in order to open the airway in the back for them to breathe properly, even while they are awake. Now, you can imagine what the problem will be like when they lay down to sleep. So if you try this, the measures or actions that you don't need any professional intervention and you still don't get any kind of relief, you definitely need professional jaw assessment. You need to have a diagnosis and you need to have a treatment plan in place to actually move you in the direction of good health. So what are some of the professional interventions that are available? Non-invasive jaw expansion, which, we've talked about before, the acronym of BOATS, meaning, biomimetics oral appliance treatment. Biomimetic meaning that the device that is going to expand the jaw is mimicking the natural physiological activities of the jaw, and that makes the jaw grow in 3 dimensions. And when the jaw grows, it can actually grow to full potential without needing any surgery, any invasive intervention. So that is the first line of action. Of course, we know that is a very pricey or expensive procedure, but the lasting benefit is that the airway that is open permanently. It's not going to become shrunken over time or whatever. Once the jaw grows to full potential, there is enough room for the tongue. And for those who have tongue tie, revision of the tongue tie can also be done to free the tongue from being frozen to the floor of the mouth. Breathing and sleep quality will improve once there's intervention, and then boosting men's health and confidence. Now, when a man is able to rest well, the testosterone level rises during the time of sleep to the highest level during the day in the morning. So some men already, observe this when they wake up in the morning, that the way their body feels is, usually the strongest during the day, because the level of testosterone starts waning and going down as the stressors and the stress level increases during the day, and the individual is working. So confidence will increase when their testosterone level is always at the optimum level. So what are some of the benefits for men when we talk about jaw health? Better jaw development means stronger breathing, and it means improved appearance. It enhances performance in terms of physical manhood, and then restores confidence. So what's the real stories of change? The real life success stories show men reclaiming energy, becoming more restful, and increasing their vitality, because the airway is now open and they are able to have enough oxygen for all the body parts that need oxygen to be optimum in their function, and hence the overall health will improve. What are the key takeaways? The one main key takeaway here is jaw health influences airway health, which affects total body wellness. Anyone who cannot get enough oxygen will not feel well. Anyone who has been an asthmatic for extended period of time will understand what that means. Somebody who has been coughing, unable to breathe properly, always breathing shallow. I can say for myself, when I had the long period of experience, with, severe asthma, it was a terrible experience, to say the least. Every time of the day feels like somebody has taken off oxygen from the atmosphere, and I'm struggling to get enough oxygen. I'm struggling to inhale. I'm struggling to stay without coughing. Every time you cough, and you cough without producing anything, it causes loss of power, loss of energy. And I can imagine anyone who is not sleeping well at night, doesn't sleep during the day, doesn't have enough oxygen, would definitely be, unwell. In every part of the body will feel unwell. So the proactive care transforms men's health with, in a very, predictable way, because once you have everything addressed, the jaws are in the right growth, the tongue is in the right position, the airway is open all the time, whether it is during awake time or during sleep. The individual will get enough oxygen. The oxygen that the body needs, particularly the brain, the heart, and the muscles, they all need oxygen. Without oxygen, any individual that doesn't have enough oxygen will become very sluggish, very tired, very weak, fatigued in every way. So it is best for us to know that jaw health will influence the airway health, and the airway health will affect the total body wellness. And so that should be our goal. Particularly since we are talking about men's health today, we're looking at men. Going to the gym is good. But when you go to the gym and you seem to be building the muscles, the external, the other parts of the body, and the muscles seems to be, developing pretty good, but you don't get enough oxygen because your jaw is not well formed, because your nostrils are always blocked. There is no amount of gym activity that will increase the vitality. So we need the airway to be open. And I'm mentioning airway all the time because we are not focusing on the dental problem. Because if we are focusing on the dental problem, we'll be talking about cavities and gum disease and all of that stuff. But no, without the jaw forming properly, the airway will be, adversely affected. And when it's adversely affected, the individual will be, will not have overall wellness that they should if their jaw, in case their jaw was well formed. So in closing, we know that strong jaws and clear breathing form the foundation of masculine health, vitality, and confidence. So we need to remember that. So jaw abnormalities in men has been seen as a hidden epidemic. They say over 50% of men exhibit signs of jaw underdevelopment, increasing airway obstruction risk. Many cases remain undiagnosed, affecting breathing and quality of life. Another area that we need to look at before we talk about the mental health is that injuries from altercations. I'm not sure whether it is social engineering, but there is hardly any movie that, is out there supposedly to be entertaining that does not involve physical combat, either from the standpoint of military engagement or people who are confronting one another for one reason or another. And the first thing that people do when they engage in such physical contact is to hit each other's jaws, hit each other's faces, any other part that can make the opponent to become less aggressive. That is what they do. But most of the time, facial injuries as well as jaw injuries are often the problem. And what are the impacts of that? I'm not even talking about sports injury that people that play contact sports like
I'm sorry? Are you making a purchase? No,
football,
I'm making a payment.
Like football, like basketball, extreme sports like, stunts, riding motorcycle at really high speed,
Thanks.
jumping from high levels, and doing all kinds of sports. This often lead to jaw injuries. And when there is jaw fracture, if the jaw is not set properly by treatment, it will often lead to airway restriction because the jaw will not align itself unless it's well aligned by the surgeon that treats the individual after the injury. So the impact is once the jaw is damaged and the airway is impaired, there will always be long-term complications if all these problems are not treated. So there are other stress-related parafunctional habits like teeth grinding, which I already mentioned earlier. Clenching contribute to jaw dysfunction. TMJ disorders and headaches and worn teeth. Anyone who is constantly grinding their teeth, whether when they are awake, while they are busy doing their chores during the day, or while they are asleep because they are having sleep apnea, will often end up with TMJ disorders. TMJ disorders is usually it usually presents itself as aches, clicks, and inability to open the mouth properly or wide because of the derangement of the joint tissue. When the teeth are worn down, either from chewing very abrasive stuff over a long period of time, or just from grinding during bruxism, it will affect the alignment of the TMJ. And the long-term side effect of that is, is that the individual will always be uncomfortable and with repeated headaches. And many times they would think it's psychosomatic, but it's not psychosomatic because the physical anatomical derangement is visible. And if it is, treated using certain, interventions, the teeth, the bite can be restored, and the normal relations between the joints components can be restored. And such individual will stop having severe headaches, which is resulting from their worn down teeth. Well, we've talked about this in passing. Long-term consequences of ignoring jaw health will lead to things like fatigue, low testosterone, breathing problem, premature tooth loss, diminished confidence, and poor health outcomes. We already know that anyone who does not sleep very well because of sleep disorders, like sleep apnea, will have high blood pressure, will have cardiovascular diseases, and also, other metabolic problems like diabetes, obesity, and, poor nutrition, which may not necessarily be that they are deprived of food, but they will be craving other foods that will not make them to be healthy. So the jaw, airway, and mental health connection. The restricted airway function reduces oxygen delivery to the brain. And when that happens, it contributes to anxiety, low mood. We already talked about the testosterone factor. Now, just by not getting enough oxygen to the brain affects the mood, as well as cognition, and fatigue also results from low oxygen. And low oxygen, which is related to jaw underdevelopment and airway restriction. Mouth breathing, we've mentioned it earlier, and in connection to psychological impact. So most people that are mouth breathers, they look like they're not normal. If you look at some of them, they have, saliva almost drooling from the corners of their mouth. Many of them, they don't feel confident because of their appearance. Their faces are narrow, and their jaws are often always apart, and they don't pronounce words properly. They have speech impediments and so on. And all of these things reduces their appearance. Diminishes their appearance as well as their confidence. So many of them will withdraw from the socially, and they have, mental health challenges. And many times they lash out at other people because they feel people are always either making fun of them or not treating them right because of their appearances. Sleep apnea, we've talked about it. We've talked about it in relation to testosterone and mental health. Mental health is connected to this because anyone who has low testosterone level will have mood swings. Their level of motivation would decline. And if it affects their overall self-esteem, definitely many of them, many of these individuals will become withdrawn, and they don't want to socialize with anybody because they don't think they match or they meet the expectation of the people around them. And so that may lead to depressive, moods or conditions, and that will eventually affect their overall mental health. Now, how do we, how does improving jaw air and airway health, affect the mental health, the mental well-being of an individual. I've already mentioned it earlier on that if the intervention is brought to bear early, if there's an early intervention in terms of assessment as well as treatment, and the airway is open, the jaw grows to full potential, the individual's self-confidence will improve immediately because they can look in the mirror, they will see their faces totally different. They don't look angry, they don't look sad anymore, on a perpetual basis. So this level of, confidence increases. And of course, the airway being opened allows them to breathe well during the day, allows them to breathe very, very well during the night. So they have enough oxygenation. One of the things that we need to remember is that anyone whose oxygen saturation in the blood goes below 80% is likely to go into a coma and may not come out of coma. So that's why the brain does not allow anybody to stop breathing for more than 10 seconds. Within 10 seconds, the brain will do everything to wake that individual up to breathe again. And if that individual is unable to be aroused to breathe again, they may go into a state of coma and, irreversible coma. So when we talk about improving the jaw and airway health for mental well-being, we are not just saying it because we're looking at it from, the dental standpoint, but we're looking at it from the airway standpoint. Once everything is restored in terms of jaw health, airway health, there is no more mouth breathing. There will be no need to worry about gum disease and cavity formation and also bad breath. So our take-home message today is remember your jaw shapes more than your smile. It shapes your airway, breathing, sleep, strength, and self-confidence. Poor jaw and airway health silently diminish energy, diminish testosterone, mental clarity, and performance. So proactive care through assessment, breathing retraining, and non-invasive jaw development empowers men to reclaim their health, vitality, and confidence. And finally, strong jaw, clear breath make a confident man. Thank you for letting me share.
Thank you so much, Dr. Ajagbe. Much appreciated. Whew. So if you please pull the slides down, that would be helpful so I can get a broader view of everyone here. Thank you. This is very important. But I have a question. Why
Yes.
can't we see your hat? It's blocked.
Oh, because I'm using a laptop. See?
Oh, okay. Now we're seeing, no, we just want to see you. Yeah, okay.
Yeah.
That's fine. Thank you. So I have a question. We see all these things in clinic. We see low testosterone, we actually test. Sometimes, when men present with fatigue, depressive symptoms, because that's basically what low testosterone will do. We check testosterone level and it's low, but none of us think about the jaw because the man looks good, looks fine. And as you were presenting, I was thinking of some of my men that have fallen into that category, and most of them have weight on them. They have the large, neck
Neck.
width. Yes. And so even because when there's sleep disturbances, We're thinking about that weight, the neck, and all of that, but not the jaw. Is there a test per se to test for this jaw abnormality so we can conclusively and
Yes,
refer them for care?
yes. It's simple. When somebody is talking to you,
Mhm.
look at the way their teeth are arranged. You can tell. When somebody has crowded teeth, you can tell. You don't even need any special device to determine that. When the teeth are not all lined up side by side, all from the front to the back, if there are some teeth that are like this, like they are all crowded up together, if you can, I don't know if you can see my fingers, like they are all crowded up like that, you know they have crooked teeth. Their teeth are not aligned. Not all of them will have the long face. Otherwise, everyone that has crowded teeth will have had long face. But the ones that do have severe situation are the ones that are mouth breathers, their lips are always apart and their jaws are always, separated because they cannot close together. Otherwise, they will not be able to breathe because they are breathing through their mouth. So just by looking at their facial posture, you can tell somebody is a mouth breather. When a patient walks to me, for instance, immediately I see them, I greet them I'm meeting them for the first time. After exchanging pleasantries and I was asking, is there any, do they have any questions for me about their oral health? The first thing I tell them is, are you a mouth breather? And they look at me like, how did you know? I say, well, I do, because I can see this, this, and this. And then when I tell them that, they're like, wow, how come nobody has told me that before? So, well, I'm telling you now, you agree with me that you're a mouth breather. And then we'll start approaching it from that point. Then I tell them about sleep. I ask them about their neck size. What's your neck size? Are you 17? If you are 17 and above, you are suspected of having sleep apnea. It may be mild. Any man that has a neck size more than 17 inches should at least do a sleep test. Let it be say that you are normal than for you to ignore it and not do it. Every woman that has a neck size more than 16 is suspected to have obstructive sleep apnea until proven otherwise. So if you have a neck size that is big and you have a jowl, you have a fullness on the neck, under your jaw, and you say, well, Yorubas will say, like you just have your neck all full. I'm not talking about those who have goiter, like swollen thyroid gland. I'm not talking about that. I'm talking about those who are genuinely fat or obese,
Big.
with jowl, right? Big, with big jowl and fullness of their neck. And the fullness of the neck is not based on thyroid, because that's a different ballgame. So if it is just the fat tissue, you know that there's enough fat around the tongue also. So if there's enough fat around the tongue, when they fall asleep, the tongue has nowhere to go. Once the tongue is, is is now relaxed. The tongue is in a relaxed position. It must go to the back because there's nowhere else to go. So what you will look for is look at the man, any man that has low testosterone, look at their teeth. Of course, you look at their throat, right? You say open, say they open up like that. The next thing you ask them to do is to leave their tongue. If they have tongue tie, you already know that their tongue will not rise up to where it's supposed to be to create the seal to allow them to breathe through the nose. So you ask, what should you look for as a primary care physician? look at their smile. If their smile, they may have beautiful smile, but they are crooked teeth. If they have crooked teeth, there's the chance that their jaw is not well formed. So if their jaw is not well formed, the teeth will not have enough space to be in their own individual spaces. They must overlap. And that's what we call crowding. And we call it malocclusion because the teeth that are supposed to overlap like this are now interlocking like this. And it's not going to work. There's no way you can chew properly with interlocked teeth. So that's the reason why many of them do have problems, not just with airway, they have problems with chewing, and they also have problems with swallowing. Because once the tongue is in the wrong place, they cannot swallow properly.
Okay, thank you. Dr. O, is this Dr. Ogunleye? Because she's the only one allowed to use that name, Dr. O.
I actually didn't know you were Dr. O until I met you last week. So I thought I was the only Dr. O in the whole of Southern Maryland and Maryland. And then Dr. Gusaya. I'm Dr. Ogurinde.
Dr. Ogunleye, welcome.
Thank you.
Welcome.
Thank you. Thank you so much. This is my first time coming in. So I really enjoyed the talk with Dr. Ajagbe. I think that was very informative. And I know there are so many people that are non-physician on the platform. So I think he actually did a wonderful job. Like, I'm learning and I'm pretty sure everybody is learning as well. So to kind of piggyback to your question about how do you diagnose small jaw as a pediatrician coming from that area, and I think a lot of people might still have small kids in the house. I think the issue is to kind of do preventative measure, because when you get older and you already have the sleep apnea and you're already having the issue, to treat that, the treatment is not that easy in terms of having to do appliance to sleep and all that. So if we can look at our children at home, looking at their dental work, when you have what people would call an overbite, you see the upper teeth kind of sitting on top of your lower teeth. That's an overbite. Kids that are also snoring at night, they may have like chronic tonsillitis and adenoids. Those can easily be corrected when they're younger. So if we can correct the issue at the early stage, maybe they won't have that problem and they have like routine dental care at an early age. I see Dr. Booker's name on the thing. I'm not sure if it's the same Dr. Booker that I know from my Medicaid committee. So, but I think she's a dentist as well. So
No, she's an anesthesiologist.
Oh, that's a
She's
different Dr.
retired
Booker.
anesthesiologist.
Okay, that's a different person then. Okay, so I think, just being able to do preventative medicine would be good. And he did touch base on the overweight. The obesity is rampant in a lot of our community because we think that's normal because it fits our clothing and it's a norm thing to be of a certain weight. But losing the weight actually reduces the snoring. So, and then if you can actually reduce your BMI and all that, then you can now address if there's any secondary issue that you need to deal with in terms of correcting the dental work. So that's a little bit I wanted to just touch in. Thank you so much.
Thank you so much. Thank you. Going to the nitty-gritty lifestyle change. An early intervention. Dr. Ajagbe, we talked about that before in children. So start to diagnose this earlier. So please.
Yeah, let me quickly add something to that, Dr. O. Thank you, Dr. Ogunride, for the comment that you made. They're right on point. I think we should go beyond earlier than that. I think we should go to the infant stage. Mothers must make every effort to breastfeed their babies. If they cannot breastfeed their babies for health reasons, well, they still know there's still going to be a future challenge for that child. Most babies that have not been breastfed end up with crooked teeth because their jaws were not well formed. The jaws are meant to be, using the biomimetics. The jaws are supposed to be stimulated by the suctioning of the breast by the baby. The vibration that takes place, the vacuum that was created during the suction, during the breastfeeding, is supposed to stimulate the stem cells in the jawbone, infant's jawbone, to actually form in 3 dimensions. So when a baby does not have that experience, the cells don't know what to do. So that's why many children are now in braces, even as early as 5, as early as, because their jaws are so small. And when the jaws are small and the tongue is frozen to the floor of the mouth because they have tongue tie, ankyloglossia, then there's a major problem. They will always be choking. Now you've seen some babies that they are constantly coughing, they're constantly choking on their, when they are being bottle fed. And they're being bottle fed or they're being fed with spoon, they're constantly choking because they do not know how to swallow. Their tongue is not released enough to go to the top, to the roof of the mouth to create the seal for food or drink to go in the right direction. It constantly causes them to cough, and many of them will end up with lung infection, from aspiration. So breastfeeding is the best gift that any mother can give to their baby. And as the baby is growing, when the baby is about to graduate from, breastfeeding, you should start giving them things that can be chewed by a baby. Not something that is too hard, not something that is too dangerous that they could choke on, but something I always advocate for children to be given chicken bone. Chicken bone is amazing. Remove the cartilage from it, the cartilage that can be easily dislodged. If you give the baby, any baby that you give that, that can hold the chicken bone in their hand, they will love you. Every time they see you, they want to jump on you. They want you to carry them because they know there's something about the chicken bone that helps their teething. It helps their teething. They use it to kind of scratch their gums that becomes itchy, when the teeth are about to come out. And besides that, it helps them to swallow because they now learn that the tongue has to move in a particular way for them to be able to swallow their saliva while they are sucking on the bone. So when the child is being weaned from breastfeeding, they should move on to adult food, but not the same consistency as the adult will eat. They can be a little less firm than the adult will eat, but they should be firm enough for the baby to start learning to chew. So that's what I wanted to add to the fact that pediatric intervention is imperative to prevent long-term, negative health outcomes that will result from from ignoring the jaw underdevelopment as well as other things associated with the jaw underdevelopment.
Thank you so much. The sad thing, though, is that we're seeing a lot of childhood obesity also. So all those things you talked about. Hey, Dr. Buka, I see you.
Yeah, I can't forget. I cannot put my arm up. Yes, thank you, Dr. Ajagbe. Professor, thank you very much. This was a topic close to me. And I am Dr. Booker, the anesthesiologist. And, every time I'm going out traveling with my daughter, I would say to her, he's a difficult intubation or she is a difficult. I just look at the mouth and I could tell if people are probably mouth breathing or snoring. And there is a criteria used by anesthesiologists called stop bang, which asks you, are you snoring at night? Are you ever tired, snoring tired?
Have you ever stopped breathing, high blood pressure, what's A now? Oh, I can't remember. Oh, if there's apnea. Anyway, it's STOPBANG. But
Apnea?
that's the criteria we use. The N is the neck circumference, and G is gender, and it usually says male. So using the stop bang, you could tell if people are snoring, even if they don't tell you. Also, high blood pressure, they have high blood pressure. STOPP is for pressure. So even if they don't admit to having sleep apnea, if you follow that, you could send them for a sleep test.
Yeah, that's what I was saying, that when I see my patients, the moment I see them, I tell them, do you know that you are a mouth breather? And then there's, many of them that know will say yes. They know that they are mouth breathers, but they have not done anything about it. So that's when I encourage them to now talk to their primary care physician to request for a sleep study. The other thing I've done so far is using the sleep assessment test, which is it's the one that tells about excessive daytime sleepiness, that they can feel within 30 seconds. They can complete a 5-question questionnaire, and it can establish the fact that they do have excessive daytime sleepiness. So that one, if anybody has that in the office, you can use that to establish the fact that the person is having excessive daytime sleepiness, which is as a result of sleep disorder. And sleep disorder may necessarily not be sleep apnea, but it's more likely to be sleep apnea.
Yeah, so if you do the stop bang, STOPBANG, and you follow it most of the time, and like I said, if you're used to looking at the jaw, most of the time you will pick up that the person is sometimes a mouth breather, and then you follow up with it. So that was what I wanted to say. And Dr. Ajagbe, my daughter did not breastfeed. So for those women who were like me, I did have to give her braces. She refused to breastfeed. She refused to drink the milk, the breast milk. So there's some stubborn kids like that. She ended up having braces, and I do encourage it. But for those mothers who are like me, and you wake up at 3 a.m. and she wouldn't breastfeed, and you have to be in the OR at 6 a.m. After a while, I lost that battle.
Well, I mean, that's why I said anyone who can afford to. If there is any medical issue or other issues that prevents a mother from breastfeeding, well, that's what it is. It is what it is. But they should know, if the jaw is not well formed as a baby, they're going to end up with braces. There is no shortcut to it.
The problem with braces, though, is that, it sets the teeth. But then if they're not using those guard, the mouth guard or this to put it in place, is going to slip again.
Yes. That's why I talked about the BOAT, the BOAT, the biomimetic oral appliance therapy, which is actually growing the jaw. That is different from straightening the teeth. We use the term braces because that's what the common men know. But if the foundation is small, you cannot crowd the small foundation with the 32 teeth that's supposed to be in the mouth. So the jaw can be grown, and we now know that we can grow the jaw up to the age of 90s. So the oldest person that's used the biomimetic, oral appliance therapy is about 93 years old. And that improved the sleep and everything that the man has been suffering for many years.
So what's the lowest age that it can
Usually about 5 years old.
And how long with the will the instrument be used?
No, it's an appliance that the child can wear. what we do is there's a measurement that can be made between the first molars, usually in the 6-year-old people that, 6-year-old children form their, they have their first molars, permanent molars. So there is a distance between the two first molars in the back across the palate. If it is lower than certain level, you already know that that person has underdeveloped jaw. So there is a cutoff measurement. So that is where, let's say it's supposed to be 44 millimeters across, and it's only 32. So you see that's 12 millimeters of deficiency. So now what we'll do is the appliance is created in such a way that as you expand it, the bone grows, you increase the expansion until you get to the full dimension that you want. And then you know that the jaw is grown to the full potential. So that's the way it works.
I have a question in the chat box. It says, can constant bad breath, especially in the morning, even though they brush daily before going to bed, be caused by a bad jaw?
Well, yes, it could. If the jaws, for instance, somebody who is a mouth breather, any mouth breather through the night breathes through the mouth. So the mouth will dry. Intermittently, he may, when the brain wakes that individual up to breathe, they may, try to swallow, the mouth may feel dry. And stimulate some saliva by trying to keep, trying to swallow. That drying, intermittent drying and wetting will create an environment whereby the breath would not be pleasant early in the morning. What I've told people, my patient and I do, is I will go to bed when I'm going to brush. The last thing I'm going to do is to rinse with peroxide. Because the bacteria that cause the gum disease and the one that cause bad breath, they are anaerobic. So when I use peroxide, I cannot literally paralyze those bacteria for the moment that I'm going to go to bed. And so that may be of help to the individual. The other thing is when you brush with baking soda and hydrogen peroxide, you are not likely going to get as bad breath as you would if you didn't do.
Thank you. Thank you so much. This was a very important presentation, life-changing. I pray that anyone on this platform who has any of those symptoms that Dr. Ajagbe went over so thoroughly would seek help or reach out to me and I'll guide you as to how to navigate. But it is important that this is taken care of. Otherwise, the consequences are not pleasant. And that's what we want to present.
Absolutely.
So, Dr. Ajagbe, I'm going to yield back to you to please give us closing remarks. But I want to remind everyone that this Saturday is the soccer tournament, the children's soccer tournament. I don't know if Dr. Alan is on the platform to post it on there, but I will send it out to everyone again. It's this Saturday. Let's come out and cheer our children on and encourage them, because by playing these sports, they actually stay away from crime, from drugs, from all those things that they should not participate in. And they need us to cheer them on. So I look forward to seeing as many people as can make it. I'll send it to your WhatsApp, to your email, to remind you. Dr. Ajagbe, over to you, sir. And I did promise that if he did not introduce himself well, I'm going to help him conclude it. Dr. Ajagbe is one of our brains around. Is an all-rounder. If you talk about allopathic medicine, naturopathic medicine, Dr. Ajagbe is there. He also was the head of dentistry at Howard University for like 21 years. Am I right?
Well, I was at Howard for
22.
For 22.
24
You were
years.
head of the department for how long?
No, okay. So I was a full professor at Howard in pathology, in oral pathology and oral histology. And I co-directed the AAID, that is implant, training program with Dr. Sacknis, who is already late now. But anyways, yeah, I was in the Department of Oral and Maxillofacial Pathology for 24 years.
24. Thank you. So I call him Methuselah. Oh, thank you so much, Dr. Ephraim. Thank you, thank you, thank you. I'm going to come back to that. Thank you. And Dr. Ajagbe has been awesome. Don't put it down. Please don't put it down. Put it up. Dr. Ajagbe has been awesome in, just educating us in different areas. And we're very grateful. He loves to teach. Thank you. So on the screen, you will see the GIS Soccer Academy, 5th Annual Sport Fest Games that I was talking about. It's in Prince George's County at the Liberty Sports Park. So I look forward to seeing everyone. And it's only a half day, 9 a.m. to 1 p.m. And we're done. Please, let's come out and support those children. It's very important. Thank you. It's free. So, Dr. Buka, thank you so much for the stop bang. I was going to call you later to ask for what each stands for. Thanks for putting it up here. Snoring, tired daytime, that's daytime sleepiness. Observed stop breathing, people's spouses or, significant others will tell them that they notice that they stop breathing when they sleep. Elevated blood pressure, body mass index, that's the height compared to the weight greater than 35. Normal is 14 to 24. Sorry, 19 to 24. I'm sorry. But when you have BMI, body mass index greater than 35, we call that obesity. And that's why I think, yeah, Dr. O talked about weight loss, right? Losing weight is very significant. Age over 50, neck circumference greater than 16 in females. In males, 17. Dr. Ajagbe talked extensively about that. Male gender, and these are criteria used for sleep apnea. Fantastic. Stop bang. Thank you so much, Dr. Buka. So, Dr. Ajagbe, I'm going to yield to you to give us your parting words.
I think somebody put something in the chat that talks about, in the chat that says something about tonsillitis with stone.
Really?
It looks like I saw something briefly. Do you see that? In the
yes. It's Dr. O. Dr. O said also a chronic tonsillitis with stones can cause bad breath.
Yes. Yes.
That is true. So you need to check with your primary care doctor if you're having that.
And also people that are always trying to clear the the back of their nose, like all the time. If you're doing that because you have some kind of irritation, either allergy or physical irritation in the area, when the secretion dries up, it becomes offensive, and it becomes a breeding ground for bacteria that I call the anaerobic bacteria. Once they get into the tissue, they get to spread very quickly. So yes, tonsil,
Tonsillitis.
tonsillitis with stone, yes, will cause bad breath, real bad breath. Now, for people who want to know a little bit about bad breath, it's not one bad breath that exists. There are many things that cause bad breath. And the characteristics of the smell that you get is what will determine what is causing it. For instance, when you have somebody their breath smells so sweet, you know, their breath is always smelling so sweet, like acetone. So you know there's people with diabetic, complications. So you need to bear that in mind. So if somebody's breath is always smelling so sweet, like, almost like rotten fruit, but still smells like citrus breaking down, you know that has something to do with diabetes. When somebody's mouth smells like sewer, and I'm not exaggerating, it smells like sewer. Anyone who has a cavity in their mouth that has been there for more than a month, if you know there's a cavity there and you know it's been there for more than a month, get a toothpick, go inside that cavity, stir it up a little bit and bring it to your nose. You will agree with me, it smells like sewer. It's basically the same bacteria that is causing the smell and breaking down of the food substances is what produces that kind of stench in the cavity. If the bad breath smells like rotten beef, if you went to the grocery store and you bought a piece of beef and you forgot it in your car, in your trunk, after 4 days, whatever smell you get from there, if you get that kind of smell from people's breath, it means their gums are breaking down. They have chronic gingivitis and periodontitis. When they have deep pocket and there is pus coming out from it, the smell is very offensive and it smells like rotten beef. Now, for the smell of people that are dehydrated, the smell of dehydrated breath is because of any food that you ate last. If you ate something that can ferment easily, if you ate beans and you did not drink any water and you became dehydrated after a while, the beans actually breaks down because of the nitrate in it, in the protein in the beans. The bacteria in the mouth that are supposed to be good bacteria begin to work on the leftover of the beans. That's where the nitrate in the beans is broken down or is converted to nitrite before it becomes nitric oxide. So we still need those kind of a thing, but that process whereby the dehydration takes place, the mouth dries up, you wet it with saliva, but the breath that comes from it is not very pleasant. It's as a result of the food leftover that is being broken down by bacteria in the mouth, natural bacteria that's in the mouth. Okay, so those are the common breaths that you know. Then the one that comes from the tonsils is the smell of pus. The smell of pus that is dried. And when that comes, it's not very pleasant. Yes. So, and all of these things can be easily taken care of by brushing the mouth with baking soda first and using the peroxide to rinse. They are both chemicals. The two chemical reactions, just keep your mouth clean. The baking soda neutralizes the acid that is released by the bacteria in breaking down the foods, the leftover food in our mouth. And peroxide will release oxygen to neutralize or paralyze the anaerobic bacteria that cause damage in the mouth. So it's a win-win if you use the two. So for men, just to round up and to say thank you all for your attention. Thank you for listening. I apologize if I went too fast for some people, but if there's still any question, you can send the question to Dr. O. I may address it off camera, and then, you know, she can disseminate that once I give the answer. But I can tell you that this problem, as it affects men, it also affects women. But the hormonal differences allows the two genders to respond, to have different outcomes. There may be some similarity in their outcomes, but the one that relates to mental health may not just be directly related to the hormonal changes caused by sleep deprivation, as in the man's case of testosterone. So please let us bear this in mind. It is imperative, if you know you have crowded teeth, you've been struggling with it for a long time, remember one of the possibilities or one of the bad outcomes that can come from not attending to crowded teeth is premature loss of teeth. So you can lose your teeth very early, because once you start losing bone around the teeth can no longer gain strength. Eventually, they will fall out. Even if you don't go to any dentist, they will eventually fall out because of no more bony support around them. I think Dr. Izugu has his hands raised.
Yeah, Dr. Izugu, kindly unmute. What happened?
I just wanted to say that's a great presentation. Sorry about that. So
okay.
I ended up sending a message to you on chat, but that was beautiful. Very well, done.
Thank you, sir.
Thank you. Mm.
So Auntie says, thank you, Dr. Ajagbe, for the brilliant presentation as usual. She says she'll check with her sons and grandsons for those indicators, but she breastfed all her children for at least a year. I give my hand.
Awesome.
Awesome. Because that's what we're advocating. That's what we're preaching. And she's sure they should be okay. Me too.
Yes.
I know them. I know they're okay. You know, that's way to go. That's what the medical society is advocating. Breastfeed your children for a year and longer. You know, it's fun for both mother and children. Dr. Buka says different values are given to the stop bank to access mild, moderate, or severe sleep apnea. She thinks just having an idea of criteria is good info for a general practitioner. Dr. Zugus thanks you. Dr. Veronica thanks you. And Dr. Alu thanks you for the awesome presentation.
Dr. O, I sent you the takeaway message.
I will send that after the talk. That's all we agreed on. No?
Yes, I'm just reminding you.
Closing remarks, and I will.
Yeah, that was my closing remark. I will just.
Okay. Thank you. That's what I'm saying. That's give us your closing remarks so I can now, give the back end of it. So Dr. Jagbe had sent something simple write-up to conclude or summarize his presentation, and we agreed that I'll send it after, because before it wouldn't have made sense. It's better now that you've heard him talk that you would understand what he now penned. And Dr. Ajagbe, thank you so very much for another awesome presentation and another session of teaching. And I wish everyone a very, very happy 4th of July. Thank God for independence. Regardless of what is going on in the world, by the grace of God, we will continue to enjoy our independence. So
Yeah.
enjoy.
Thank you. Well, I'll be saying hello to you from Lagos next week, next Monday.
Yes.